Everyone ready to go? Thanks for joining us. There are 5,696 cases of coronavirus in Victoria. That's 363 new cases since yesterday. 36 of those are connected to known and controlled outbreaks. 327 of those cases are under active investigation. There are 2,837 active cases across the state. 130 Victorians are in hospital and 28 of those are in intensive care. I'm very sad to have to inform you all that there are now 38 fatalities as a result of this virus. That is 3 further deaths since yesterday. 2 men in their 90s and a woman in her 90s. And we send our best wishes to the families of those 3 individuals. This will be a particularly sad and challenging time for them, and we send our love and support to them. The total number of tests are now 1,305,186. That's 26,674 tests yesterday, which is a massive effort. And again, I thank every Victorian who's come forward and got tested, even with the mildest of symptoms. That data gives us the key to this, the key to winning this battle, and that is knowing where those cases are and being able to take steps to isolate those positive cases as well as any of their close contacts. That limits the spread. It's an obvious thing, a simple thing, but it makes a powerful difference for all of us. So I do very clearly thank each and every one of those people that have come forward, and I continue to encourage people to come forward at one of the more than 160 test sites right across our state. That testing is absolutely critical, and I'm so grateful to those who are taking the time to get tested. That does make a massive difference. I can inform you that 123 of the Alfred Street Tower residents remain in ISO. They are not allowed to leave their unit or their flat. That's a significant number, but each of those people, whether they be positive or a close contact of a positive case, they've been taken through all those steps. They've been informed of their status. They'll continue to receive support and care, both in practical ways, food and groceries, those sorts of things, as well as counselling and other support, medical care. Anything that they might need will be provided to them in recognition that it is a unique environment. Now today, there are some new restrictions that I need to announce. First and foremost, masks and face coverings will, from 11:59 p.m. Wednesday night, be mandatory for everyone in Melbourne and Mitchell Shire. If you are out of your home for one of the 4 permitted reasons, then you need to be wearing a mask, and I stress, or a face covering. It need not be a hospital-grade mask. It need not be one of the handmade masks like I was wearing when I came in today. It can be a scarf, it can be a homemade mask. As you know, we have the best part of 2.5–3 million of these masks on order. The first really significant, batch of those will arrive this week, around 300,000, perhaps a little more than that. And we will have more to say about how we're going to distribute those, the different methods we'll use, and who will be eligible to receive those as quickly as possible. I'll give you one example. I think GP surgeries will be an obvious place where we can, particularly for older people who may have difficulty in finding a mask or being able to go out shopping for one or even make one. The further details on that will be provided a little bit later in the week. The first of those items don't arrive until about mid-week, but we'll have more to say about that in due course. Now, the common sense will guide this. This is on the advice of the Chief Health Officer, that it's a relatively simple thing, but it's also about embedding behaviour that I think is going to be just as important on the other side of this second wave as it is in bringing these case numbers down. We are going to be wearing masks in Victoria and potentially in other parts of the country for a very long time. There's no vaccine to this wildly infectious virus, and it's a simple thing, but it's about changing habits. It's about it becoming a simple part of your routine. Most of us wouldn't leave home without our keys. We wouldn't leave home without our mobile phone. You won't be able to leave home without your mask, and then wear it where it is absolutely essential to stop the spread of this virus. Now, common sense, as I said, will be the rule here. If you're out running, part of your daily exercise, then it may not be practical to wear the mask while you are running. but you should bring the mask with you and you should wear it before and after you've gone for your run. There'll be some other environments, for instance, where if you were going into a bank, for instance, then you would need to take your mask off. If you worked at a call centre, then it may be very challenging for you to perform your duties wearing a mask. Again, common sense is what should guide us, and that common commitment, that universal commitment that if we all do things like this, we will stop the spread of this virus, we'll get to the other side of this second wave quicker, and we will prevent more tragedy. And again, I want to just emphasise that point, the growing international evidence about the fact that this is as much a chronic condition as it is a virus that you get and then shed and then return to full health. That is not necessarily the case for many, many people across all age ranges, across all health status prior to becoming infected. This is not a good thing to get, even if you are otherwise healthy. It is relevant to all of us, whether we have underlying health conditions, regardless of our age, regardless of our circumstances, our postcode, regardless of any of those factors. This is not something that anybody wants to get because it can present and be particularly nasty, even if you were to, even if you weren't to finish up in hospital and have that intensive care. It is just not something that we want to see spread any further than it has already been. Now, police will be out there enforcing this rule as they do all of the rules. There will be a $200 fine if you were out and were not wearing a mask. I hope that not one single fine needs to be issued. That is my genuine hope. And I think that if people just use common sense and see this as a practical contribution that they can make to our collective fight against this wicked and cunning enemy, then there's no need for anybody to be fined. Where you can make this small but important contribution, then you'll be helping your family, protecting your own health, protecting your local community, indeed protecting the entire Victorian community. I do just want to emphasise as well, masks or face coverings. A homemade face covering, whether it be a bandana, a scarf, a mask, no matter what grade that mask is at, is better than no face covering at all. Once we have those significant supplies of reusable masks, similar to the one that I was wearing when I came in, then that'll fix any issues around people having to put things together over the next couple of days. But they're made by hand, and it does take quite some time to get that sort of volume done. This is a next step. It's a powerful next step. It doesn't come at an enormous cost to the Victorian economy. It still allows us to go about our business, particularly those who can't work from home, and of course things like going and shopping for the basics that you need when you need them. Can I just indicate that if we can see high degrees of compliance, if we see people wearing masks, so all of us when we're out and about for those 4 lawful reasons wearing masks, then that will mean it is less likely that we have to move to things like only having exercise, only doing that daily exercise, for instance, in your own local postcode. Or things like saying, well, you can only go shopping within a certain radius or a certain distance from your home. We don't want to get to those steps. If we have to, we will. But the next step in our fight against this virus is for everybody to be wearing masks when they are out for those 4 permitted reasons. And again, can I remind Victorians that the 4 reasons are not an invitation to leave your home. They are acceptable reasons that you can leave your home, but only when you need to, only when you really have no other option. Stay at home means just that. Stay at home and moderate your behaviour. Spend much more time at home than you otherwise would. That should be the default setting, and then work your way backwards from there. Do I need to go shopping every single day? Do I need the items that I was going to go shopping for? I think people understand these rules well, and I'm deeply grateful to the vast majority of Victorians who are following them. It is making a difference, but we do need to take these additional steps. Beyond masks and face coverings, I'm going to ask Jenny to speak to this in more detail, but about 80% of our new cases since mid-May are being driven by transmission in workplaces, including private sector aged care. We have a specific plan in partnership with the Commonwealth to deal with the fact that, unbeknownst to them, many casual staff are moving into nursing home environments and bringing the virus to work with them. We know the catastrophic impact that could have on very vulnerable residents, but it's not just about, that is a very important way to view that challenge, but it's also contributing to our numbers, and it's contributing to the community transmission, the transmission within the Victorian community in a significant way. That's why Victoria Police WorkSafe and our public health team will be visiting and working very closely with a number of high-risk workplaces. I think there's been some coverage of that today. There will also be a specific plan in relation to private sector aged care, and I'll let Jenny go through that, around testing, cohorting of staff, the wearing of face masks as well. I want to again emphasise to anyone who, because they got tested, because they're positive or a close contact, if you're going to miss a shift, if you're going to be financially worse off, public health has to come first. I understand why many people have that, given the casualisation of our workforce, a big challenge that's been well and truly exposed during this global pandemic. I understand that is a very difficult choice for many families to have to make, but I again remind all Victorians the $1,500 hardship payment is there for exactly this reason, so that you can avoid having to make a choice between the health of the Victorian community, the safety of the Victorian community, and the well-being of your family from a economic point of view. I don't want people looking at their bank balance and making a judgment that they have to go and do that shift even though they've got symptoms, or they've been tested and they're waiting for a result, or they've been tested and they're positive, or they've been informed that they are a close contact of somebody who is positive. We don't want those choices being made, and there's no reason for those choices to be made, given that that $1,500 hardship payment is there for exactly these reasons. If you are casual, if you do not have sick leave that you can fall back on, if it would take time to basically become eligible or to receive a payment by other means, that $1,500 payment is exactly there for you. It is very important that people make that choice, knowing that there's that $1,500 safety net. Make the choice that's in favour of public health rather than any other choice. But Jenny can speak to those matters and other issues in relation specifically to private sector aged care. Finally, the issue in relation to masks and face coverings will operate in our schools. It won't operate for teachers as such, because obviously communicating, being able to, as the Chief Health Officer has made the point a number of times, being able to see the teacher's face is very important in terms of that education process. Where a teacher can wear a mask, of course, I'm sure they will, but students who will be able to wear masks, it'll be less of a barrier to their educational experience to and from school, and wherever practical at school will need to wear masks also. This is all about stopping that transmission of the virus. It's all about doing everything we possibly can, particularly measures where there is quite a low cost but a very, very significant benefit. And the wearing of masks mandatory across Melbourne and Mitchell Shire whenever you're out for one of those 4 permitted reasons is a relatively simple thing to do. I know it'll be a bit confronting for some people to be moving around the community, and I fully appreciate that. But when you think about it, in terms of the benefits that we can achieve by adding this to our strategy, then we will be able to all make that important contribution and be much better off because of it. As I said, we'll have more to say later in the week about additional supplies of masks, the method to get those out to people. That example of GP surgeries is just one. We'll have more of those, and we'll look to get as many of those reusable masks out as fast as we possibly can. In the meantime, it isn't just masks, it's face coverings as well. A scarf will do, because any face covering is better than no face covering. Just the final point before I ask Jenny to speak about aged care in particular, because that is now driving not just the volume of cases, but is clearly a really significant challenge when you consider the underlying vulnerability of so many patients in aged care. I just want to make a point about the fact that whilst a mask or a face covering will be of benefit, it doesn't mean that we can be shaking hands again. It doesn't mean that we can be closer than 1.5 metres apart. It doesn't mean that hand hygiene is any less important. And it certainly doesn't mean that you can head out of your home for a fifth or a sixth or a seventh reason. It is about getting the maximum outcome, the maximum benefit from the strategy that we have in place. It's an extra layer of protection, but it doesn't mean that any of us can be any less vigilant when it comes to all those common sense things. Washing your hands, cough etiquette, keeping your distance, and only going out for the things you need when you need them, and seeing those rules as a guide, not an invitation to go and do things that you really don't need to do. Can I just, again, as I always do, thank each and every one of those Victorians, millions of Victorians, who are abiding by the rules, who are making great sacrifice and are working with us, with a team that is thousands and thousands of people large. They're all working very hard. They're doing their absolute best. So too are the vast majority of people across Melbourne and Mitchell Shire, and indeed in regional Victoria as well. It is making a difference. It's the only strategy that will work. It's the only way forward. And to those who aren't following the rules, again, Victoria Police, we've seen a little bit of reporting over the last couple of days about some terrible examples of people just doing their own thing and not necessarily having any regard at all for the health of others. They will be fined. That sort of behaviour is not on, and that's why there are police out there in force. They're not mucking about. They will fine you. It's the wrong thing to do, and it's just not a very smart thing to do, because your odds of getting caught have never been, well, worse from your point of view. You will be caught and you will be fined. But again, thank you to those who are doing the right thing. It makes a massive difference. Now, on private sector aged care and the unique challenge that it poses, and the really tremendous partnership that we have with the Commonwealth, Judy's got some significant announcements to make about that.
Thank you, Premier, and good morning. I just want to begin firstly by explaining that given we have a continuing public health emergency, this morning I have extended the state of emergency for Victoria until 11:59 p.m. On the 16th of August, and that decision has been made, acting on the advice of the Chief Health Officer, given that we continue to see rising case numbers, increasing numbers of people being hospitalised, and sadly also increasing fatalities. And today we have seen a further 20 Victorians being hospitalised, and sadly a further 3 lives lost, and I want to express my condolences to each of those families as well. So we are seeing increasing case numbers, and the situation is still very serious. And in recent weeks, we have been seeing a significant number of outbreaks in our aged care sector, and these are the most vulnerable people in our community. We've seen fatalities, we've seen many staff members inadvertently going to work who may not realise that they are unwell with coronavirus, and putting potentially staff, colleagues, but also significantly residents in those nursing homes at risk. There has been a significant amount of work that's been undertaken in recent days with the Commonwealth Government as the government that largely funds and regulates the aged care system. And I want to take this opportunity to thank Senator Colbeck, Minister Hunt, and also my Victorian colleague, Minister Luke Donnellan, for the work that they have undertaken with me to address the concerns that we have about the risks that the aged care sector and residents in the aged care system are experiencing. So today, the Commonwealth Government, together with the Victorian Government, are announcing a significant package of measures to minimise the risk of harm, to minimise the risk of further spread of this virus in our aged care facilities. We know that we have a transient workforce, in many cases a casualised workforce working across many aged care facilities. We have seen specific instances in recent days of staff who've worked across multiple facilities, and then we've had multiple outbreaks across those facilities. So the package will involve workforce funding support. The federal government will be providing funding as the funder of this system to ensure that employers can minimise the movements of staff across facilities. This is a really important step forward in terms of reducing that risk, and most importantly to ensure that workers will not be financially disadvantaged by these changes. So there will be funding to be provided to ensure that aged care employers cover any additional entitlements to enable employees to work at a single site. As the Premier has explained, as a Victorian government, we are already providing a hardship payment. So if an aged care worker, or in fact any worker, does not have access to leave entitlements, they can access a $1,500 payment from the Victorian government to ensure that they can be isolated for that 14-day period because they've been either diagnosed or are a close contact. This is a really important measure to ensure that people are not having to make a difficult choice between putting food on the table for their family or turning up for work when they are unwell. Other parts of the package will also involve more infection control training that will be provided by our government to ensure that aged care facilities are well equipped and understand their obligations around infection control. There will also be further testing that will be undertaken. The Victorian government, you'd be aware, has provided asymptomatic testing of aged care workers. The Commonwealth now is going to work with us around these issues to ensure that we can get aged care workers routinely tested for coronavirus, again just to make sure that we are locating cases, identifying cases, making sure people are isolated as quickly as possible. So the Commonwealth will deploy 5 new testing teams as part of this to test staff, but also residents in residential aged care facilities across Melbourne and Mitchell Shire. I've spoken about this previously, but we're grateful also to the Commonwealth in providing face masks to aged care facilities. We as a Victorian government, of course, provide all PPE to our public health facilities, including our public aged care facilities. The Commonwealth is now going to be providing face masks for staff across all aged care facilities, not just in the hotspot areas, but making sure that staff have the PPE that they need working in a vulnerable setting. So there is a very comprehensive package. I want to express my gratitude to the Commonwealth for acting very quickly on my request to address these risk factors. We believe that these changes are going to be very important changes to addressing the risks that we are seeing with those significant numbers of outbreaks and staff and residents testing positive in recent days. Finally, I just want to add to the Premier's comments. We will be making some other changes, I should say, to our health facilities. We are looking at how we can minimise the risk in all vulnerable settings. We have seen healthcare workers testing positive in our health services. We are obviously providing the top tier of PPE equipment to our healthcare services staff. And I would urge Victorians not to let perfect stand in the way of the good. I myself today am wearing a homemade mask, and I think that many Victorians will be able to make a mask like this. We have translated materials available on the DHHS website for people to make a mask themselves. So don't be stressed or anxious if you cannot get your hands on a top tier surgical mask. You can make one yourself, you can use a scarf, you can use a bandana. Something is better than nothing, and we will be making it a legal requirement from the middle of this week for you to wear a mask. But when it comes to our health services, we want to reduce the risk of people bringing in the virus into our health services, so we will be putting some additional restrictions on visitation into both our hospitals and aged care facilities. We'll be working very closely with health services to do this in a sensitive way. Obviously, there will be some exceptions there for parents looking after children, also making sure that people can still get access to carers. So carers only will have access to the ability to visit someone in hospital for 1 hour per day. We have seen health services already put some new policies in place in their health services in recent weeks due to the concerns that they have about their staff and their patients, and we want to make sure that there is not an ad hoc approach, but this is done in a uniform way so that families and patients can understand how these obligations will work in the future. So when it comes to our advice and our message to Victorians today, I just want to reiterate the Premier's message. The masks and mandating mask usage is an important additional tool that we will use to minimise the spread of this virus. It also means we need to continue to do all those other common sense things, staying at home as much as is possible, washing our hands and getting tested as soon as you have even mild symptoms. Thank you.
Can you do 12-year-olds and under one medical condition?
Sure. Thanks, Minister and Premier. So 363 new cases today in Victoria. We are on a bit of a numbers roller coaster at the moment, but with no absolutely clear sign that numbers are decreasing. I hope the trend moves in that direction. But the recommendation on masks is really because it's one of those, again, low cost, relatively easy, small imposts that can make a real difference in transmission. And when we know that there are essential reasons to go out, it is one of those additional things that can protect both ourselves and those around us from transmission from coronavirus. It is a new norm. We'll have to get used to new behaviours, but I think Victorians have done really exceptionally well with all of the new habits that we've had to take on over the last 5 or 6 months. Whether it's the spacing that we find ourselves standing on in supermarkets or cafes, the distance we make when we're passing someone in the street, the hand washing, the excluding ourselves when unwell, and going for testing even with just a runny nose. We've really stepped up, and I think we'll step up with regard to masks as well. It is a recommendation for everyone over the age of 12. That is in recognition that it's likely to work for all of those age groups. Below the age of 12, it's a consideration. We say not for toddlers, so not 2 years and below, but it's a consideration for all other children. But it is mandatory really from that high school age onwards. We don't want kids to be some of them to be enforced to be wearing them in primary school and others not to be. So it really is just for those 12-year-olds in high school and above, and for all of those other reasons when we're leaving home. For people with medical conditions, there'll be exemptions. For other people who for one reason or another cannot wear them, there'll be exemptions. And obviously when you're engaged in activities where it's entirely impractical to wear them, then that's not a requirement. But it does make a difference, and having universal mask wearing is the key here, because not only are you, if you're potentially infected, shedding less virus into the atmosphere, but the person around you, if they're 1.5 metres away or closer or further away, will be less exposed. And if there's virus out there in the atmosphere, there's some filtering that happens with those cloth masks. And as we say, it doesn't have to be a mask. It's a cloth face covering. It does need to cover the nose and mouth. And as some of you might have seen, masks don't do very well in your pocket. They don't do very well when they're sitting on your chin. They do need to cover your nose and mouth to work properly. So that really needs to be reinforced. But I am very confident that we'll take this up as a new behaviour in Victoria, and that it'll make a significant difference. We do have these settings that amplify transmission. We're addressing transmission within and between homes with the stay-at-home directions. But for all the reasons that people need to go to work, this is one of those additional measures that will help, because workplace settings, sometimes with very large workforces who have to be in closer proximity, they can amplify the transmission. We know that meat works are an issue. We know that aged care, healthcare settings are an issue. Distribution centres with sometimes very large workforces can be a real amplifier of transmission. So they're all the kind of settings where staff are going to be wearing masks from now on in, and for it to be mandated. In terms of outbreaks at the moment, we have seen 3 additional outbreaks in aged care. There will be the full details in the CHO media release this afternoon. We've also seen single cases in some youth justice and Melbourne Remand Centre settings. So for 2 individuals in Melbourne Remand and youth justice, they have been diagnosed with coronavirus, both isolated. Doesn't seem to be a risk to anyone else. There is a normal process of quarantine for new entries into remand or prison, which protects the wider prison population, and that's working very well. There is a 3rd setting with a teacher who's tested positive, and that will involve some contact tracing, because although physical distancing was present, we do need to follow up all the potential close contacts amongst that population.
We'll take any questions.
And the changes to the masks, has that come about because of recent research that's showing that this virus is more airborne than we thought it would be?
I know there's always been controversy about whether it's just droplet spread or whether there might be airborne spread with this virus. I think the key evidence that's come out recently is that regardless of our assumptions about transmission, wearing a mask makes a practical difference. So just following people who wear masks and the settings in which masks are worn has shown that there's a really significant 2/3 or more reduction in transmission. There might be circumstances where instead of droplet spread up to 1.5 metres, that the virus can carry further. But the practical effect of masks is that no matter what the transmission is, it reduces the load that gets out between people, and even, you know, imperfectly made, those masks make a significant difference.
What's the advice on face shields?
Well, face shields do have a benefit. They work not dissimilarly to masks in terms of reducing the transmission between people, and they can have significant benefits for individuals who need their facial expressions to be seen. You know, I'm aware that children with autism often take clues from facial expressions, and so there might be settings where a face shield has some benefits, obviously the protective element, but also the communication benefits are apparent.
Would you prefer one or the other, or would you prefer masks?
No, really, masks are our recommendation across the board for the community. I think there are some specific settings where a face shield is a consideration. That includes in some healthcare settings as well as an additional protection, but it's not a routine recommendation for the community.
And in the workplace, where people can distance by 1.5, but there's multiple people in the workplace, do you still recommend that?
Yeah, we do. I think one of the things about the 1.5 metre distance is it's not perfect. We know that there's a benefit in making that distance even greater. There's still a reduction in transmission out to 2.5, 3 metres. And we also know that, you know, we go into a setting thinking, I'll stay 1.5 metres from everyone, but there are moments where people come within that distance. And so really, in indoor settings, it's a better habit to have that mask on all of the time for all of those occasions when you might come closer to someone else than 1.5 metres.
The $200 fine is considerably less than other social distancing fines. Do you actually think that that's going to be enough to deter people?
I do. Again, I think Victorians have done a brilliant job in getting these new behaviours into place. I think they'll see the benefit. I think it'll be understood to be relatively easy, and I think it'll become one of those habits where we look around, everyone else will be wearing a mask, and you know, there'll be some social pressure to do the same.
Was that part of the thinking that Victorians had adopted it really well over the last, I don't know when it was introduced, a week or so, that you sort of wanted to see how that would play out, and then what were some of the discussions about this phase of introducing the masks?
Oh, certainly we made it as a recommendation, but with numbers not decreasing rapidly, and with a real need for that to be the case, and with a small additional impost, to be able to get us to our target earlier, whether it's zero transmission or whether it's just getting down to single figures, we want to do that in as fast a time as possible, and mandating is just one of those additional pushes that'll get it to kind of universal coverage much faster.
Just with schools, I mean, practically speaking, is that the expectation from well, when they leave home, when they get home, the kids will be wearing a mask, and how do you manage
So obviously, if you're drinking, if you're eating, you're not going to be wearing the mask. But yes, for the rest of the time, the expectation is that that mask is worn. These won't always be really easy, and they won't always be welcome, but they are important. And there are lessons increasingly internationally about the jurisdictions that are doing well have introduced mandatory mask wearing, and those that haven't are the ones that are seeing really catastrophic numbers at the moment.
From when the first recommendation was made, we saw masks sell out pretty quickly. No doubt from today we're going to see that again. Are you confident that there's going to be a supply, and should maybe the general population be looking to use those homemade options or the scarves rather than trying to get that medical grade coverage?
Yeah, I think people shouldn't stress or become anxious about not being able to access one in terms of a purchased one, because there are opportunities to make one at home. We've got instructions on our website. There are many other websites that show you how you can make a homemade mask. And what we're talking about is a face covering that covers the nose and mouth. And so I think almost every household will have an option to do something akin to that. So people shouldn't fret about not being able to get a tailored mask or one that's a medical grade or akin to that. They just need to find a face covering and be able to wear it from Wednesday onwards.
And once you have one, we've seen doctors advising that you can't touch the front of it. You need to wash your hands before you put it on, after you take it off. What's the sort of, I suppose, general advice that people should be following when it comes to face?
Yeah, the general advice is to wash your hands before and after with soap and water or with an alcohol-based hand rub, to not touch it as much as you can avoid it, and when taking it off, not to touch the front of the mask as well. It's also, obviously, as a cloth mask, it's also useful to have a few and to clean them. I put mine on the hydronic heating this morning to clean one so that I could have another one ready for today. And just to rotate them through so that you've got a clean one each and every day.
Professor, the AMA described the number on Friday as catastrophic. Yesterday it went back down, but today it's a pretty concerning number. How concerned are you that there's no pattern back down?
Yeah, it is concerning. That's why one of these issues about implementing masks is we're not going to wait for numbers to decrease. This is something that we should be doing now, regardless. And the 2-week period from the stage 3 restrictions hasn't come yet, and so I think there's still an opportunity to see those numbers drop. But in a sense, these settings that amplify transmission are our new target. And I think we are addressing transmission between homes and within homes, but we have a new target here, and a lot of the new numbers today will be related to those settings that we're now trying to get on top of with a new intervention.
Although those stage 3 restrictions didn't apply to Metropolitan Melbourne and Shire until 10 days ago, those plots for a lot of local government areas and postcodes have been in stage 3 restrictions for 3 weeks now. So is it, and they're still considered hotspot suburbs, so what's still driving the transmission there?
So certainly those initial hotspot postcodes that have been under a lockdown for a longer period of time still have not insignificant numbers. Part of it is when you get a spill of significant transmission in the general population, that then it's taken to those workplaces, and then it's transmitting for those essential reasons to leave home, because there's just more people who are positive with coronavirus. This is where masks will play a role. We have seen some stabilisation in a number of those postcodes, but they have had big case numbers. So it's a mixed bag. Overarching restrictions that apply to Melbourne and Mitchell Shire, I think, are pretty robust and will make a difference. But we have to do everything. We have to pull out every tool as required in order to get on top.
So when at the end of the 2-week period for the stage 3 restrictions for Melbourne, we might not see cases come down?
We have to be ready. We have to be ready for whatever. If we see that there's a drive in transmission in a new setting, in a new cohort of people with a new challenge, we'll need to respond to it. Again, based on the data, based on the epidemiology. I'm not being complacent about the fact that we've done enough. We need to watch those numbers, and we need to think about whatever else is required on the basis of that day-to-day review.
So the measures in moment an alternative to moving to sort of metropolitan-wide stage 4 restrictions?
I wouldn't call wearing a mask as an alternative. I'd call it a really important additional measure. It is something that can potentially avoid needing to go to different restrictions. So we should do it. It's going to be a benefit, but we shouldn't regard it necessarily as sufficient.
So how close are you to pulling the trigger on stage 4?
Well, we don't know. We have days to watch. We've got this new intervention. We've got a daily review of settings and transmission that we need to reflect on.
Professor, you talked about precautionary principle a lot. Why weren't masks thought of as a precautionary venture earlier than this?
Well, certainly the national recommendation was that they weren't recommended. We were following that national recommendation with very low levels of transmission. We went through our entire first wave without universal mask usage or mandatory wearing of masks. I think there are a couple of things. One, reflecting on this wave as significantly more challenging, different populations involved, more community transmission, and numbers ticking up. And when the transmission reached a level that we saw was going to challenge us, I was keen to make that recommendation to the Premier and to Cabinet. There was some time to develop the communication materials and to make sure that we had the policy and the all of the supporting information available. But I hope that it's full guns blazing now.
So when did you take it to the Premier?
I can't remember the exact date. I can't. It was about a week before the formal announcement, as we were working up all of the communication materials.
Considering that toddlers can't wear masks, where are we in the childcare?
Yeah, so it's not a requirement in childcare. We've seen very, very few cases in childcare. Childcare hasn't closed anywhere in the world that I'm aware of, even as primary school and high schools have closed at one point involving more than 90% of students. Childcare doesn't seem to be a place that either drives transmission or that we should be concerned about in terms of significant illness.
Will masks be mandatory for childcare workers?
No.
The 3 deaths overnight, were they in Melbourne?
They were in metropolitan Melbourne. Yeah. 2 were in aged care.
And
Yeah.
one was,
Another setting.
okay,
Yeah.
do you have the genders and ages?
I think they were all in their 90s.
2 men and 1 woman.
How many aged care facilities are there?
Oh, that'll be in the Chief Health Officer update this afternoon, but 3 additional today.
That'll be around.
Yeah, it would be.
Professor, given today's number, there's another big of contact tracing. How comfortable are you at the moment with, the time between these cases being identified and the time to actually identify those close contacts?
Yeah, very happy. We got through the 420-day on the same day, where we got through all of those cases yesterday. We'll get through all of today's cases. I'm aware that there are some contacts who needed to be manually entered into a database so that we could have the automated notification to close contacts, but those close contacts were notified by phone anyway. But there are some manual processes, in part because we're getting the assistance of our interstate colleagues, and we don't have a single interoperable IT system across all jurisdictions. We're needing to task some of those interviews to our interstate colleagues and get them back, and then have manual data entry for them.
What's the ref number at the moment?
It's close to 1. We haven't calculated in the last couple of days, but it was pretty much sitting on 1 a couple of days ago. But there are different assumptions that go into models. Some of them have the ref sitting just above 1. Some of them have it sitting at 1. Again, I won't sit back and relax, even if the ref is calculated at below 1. We need to watch the numbers to see what's actually happening.
Clarify on the last point before you said that you recommended that they be mandatory a week ago, but it took a week.
No, I recommended that we should have a recommendation for masks early on, and then that recommendation came with all of the communication materials when they were developed.
So when did you actually tell them that you'd like it?
I can't remember the date.
Can I just ask a bit more about comments from today? Until today, we've consistently heard that the transmission in Victoria is
Yes.
Today you said that since you've made 80% transmissions being driven by the workplace. So which one is it?
Well,
Is it family transmission?
things change, Samaya, and in fact it's actually both. What happens is people can go to work sick, they can spread it at work, and they can also go home and spread it amongst their family. And if people are not following the rules and are persisting with family gatherings, which can often be quite large, then one family can infect another. I think we've seen a situation where about a third of our transmission could be associated with family gatherings, and that's what's driven in large part the numbers we've seen at the outset in the north and the west. But that number is now down to below 20%, and the vast bulk of the rest of cases are transmission that can be traced back to work. So it's not about who necessarily is the index case. It's about, as the name suggests, it's about the transmission of the virus, not how you got it in the first instance necessarily, but how it is you're giving it to other people or putting other people at risk. So workplaces, I think the key point here is find the problem and then take action to deal with it. And what we know is that, for instance, private sector aged care is a really significant problem. That's why we've got a dedicated plan and a partnership with the Commonwealth to deal with that. We know that there are a number of high-risk workplaces, industry sectors, and that's why WorkSafe Victoria Police, with the guidance and advice of the public health team, will be moving through all of those sites, making sure people have got the very best protocols in place.
Given that we have a 7 weeks outbreak and given that workplace transmission has been an issue since you've made it independent, do you think it would have been better to maybe do all of this a little bit sooner?
I
At
don't.
least in these workplaces?
So, Mayor, I think there's been best efforts across the entire Victorian economy, and people have acted on the data as it's presented. It's very difficult to put in place a response to a second wave when you're in the first wave. Logic just tells you that you have to respond to the circumstances. They do change from time to time. In fact, they change every day, really. These are the most appropriate responses. There's been a significant effort in a number of those workplaces. In fact, in all of them across the board, those high-risk sectors, but the risk is much more acute now as we see more community transmission and more cases. So it's not a matter of doing something now that wasn't done previously. It's about taking those efforts to another level and making sure that we've got, the double check, the best system in place, and that everybody in those sectors, in those businesses and workplaces know that there are things they have to do, there are standards they have to meet, as much for their benefit as anybody else's.
What will be your approach when it comes to public servants and workplaces? Will you be keeping public servants working from home if possible, and how long?
Well, the stay-at-home orders mean that any person who can work from home should work from home. I won't name the law firm, but we did see a firm that's become a bit famous in recent days where they decided that they wouldn't allow their staff to work from home when clearly the vast majority of that work can be done from home. There's now an outbreak in that very firm. So this is serious. If you can work from home, you must. I know it's not easy. I know it's very challenging for a lot of people, but whether you're an employer or an employee, if you can work from home, you must work from home, and the public sector will be leading by example. We've got the vast majority, it must be close to 250,000 people, a couple of 100,000 at least, that are in the main working from home. I'll give an example. I come in to do this media conference. I'll have a short meeting beforehand in my office. I then collect my things from my office and I go home and I work the rest of the day from home. And I don't think I have left the house for the best part of a week, maybe even longer. That's what we have to do. We all have to change the way that we are living our lives. Now, there might be an occasion when I leave the house, again, for one of the 4 reasons, and only one of the 4 reasons, and only when I need to. So it's important that the public sector shows, I think, the best policy response to this, and that's exactly what the public sector is doing.
And how significant will the team of police work-safe inspectors be when it comes to actually getting out there and moving around? Hundreds?
I think it will be, yeah. It'll be a very significant team. I'm happy to come back and give you some more detail on exactly how big that'll be. But, none of this will be news to those sectors. They know because they've been engaged with for a long time now, but they'll have a sense that they know there's certain things they need to do that directly mitigate the risk. You never reduce the risk to zero, but it all helps. It all works. And that's the virus as it's presenting at the moment. There's still some family-to-family transmission and transmission within families, but many more cases where people are taking the virus, often unwittingly, to work with them, and therefore we need to make, that's where masks come from, and it's where some of those workplaces that are high risk because of the lack of distance, temperature, all those sorts of things, large volumes of people moving in and out, it just makes sense to up, if you like, or take to another level the sort of practices and processes that those workplaces have got in place.
Will there be any fines for employers? Because there's a $200 fine if employees aren't wearing a mask, but if you find that an employer is discouraging mask wearing or not being supportive,
Well, I think there probably wouldn't be a $200 fine. That'd be a fine much more akin to the other business fines. So if you were, to use your example, Alex, if you were actively discouraging compliance with the Chief Health Officer's orders, then you face a very significant fine. I don't expect that to happen, by the way, and I don't want to see, I don't want to see even one single fine when it comes to wearing masks. It is something that we can do. It's something that makes a big difference, and I'm really confident that Victorians will embrace this, and they'll know as well that it's not just for these next 4.5 weeks. It's potentially for many, many months. There's no vaccine in sight for this. And if we can change our behaviour, if we can embrace this and just make it part of our normal day, then it will not only be very useful in driving numbers down, but it'll be arguably even more useful in making sure those numbers remain low for the medium and long term.
And just to be clear, you want people in offices to be wearing face masks?
Yes.
We will be wearing face masks in the office.
I expect when I'm here tomorrow for the briefing, I think it might be rather difficult for me to talk to you if I had one on, but all of you would be wearing one, and there are a number of people in the room right now that are. And the other thing too is that's a double sort of protection on the basis that everyone's at least 1.5 metres apart. So.
in the rush that we had on.
I think if you are driving to work, you can wear the mask. If you're with a member of your family, then it's no different really to being at home. But if you can wear it as often as possible, and you certainly wear it when you're out for those 4 reasons. So workplaces are a big part of our challenge. That's where a lot of our problem is. The alternative is, as frustrating as it might be for some to wear a mask, the alternative is to say, okay, I'm going to go through a list of every industry, and we're going to try and determine, the Chief Health Officer and I, which are essential and which aren't. And I think that will cause enormous damage, even more than this virus has already done. So common sense, I think, really guides it. And it's not like police are going to be pulling over every single vehicle or every single person to check you're wearing a mask, but err on the side of caution, err on the side of doing more rather than less, err on the side of protecting yourself, your family, the community, every family. Don't take the time to try and find loopholes. That doesn't do anybody any good.
Given the rush that we had on toilet paper and other
Yes.
commodities, would you like it if larger retailers put fines on masks for the next couple of days?
Oh, I think that'll be a matter for them, but we're happy to talk to them in terms of supplies and any pressures any pressure points they have at retail outlets. But the point again, and I'll be indebted to all of you if you can try and make this a real feature of the coverage of this throughout the day and into the evening. Masks, yes, face coverings as well. A face covering is just as good in that nothing is perfect. Even one of these N95 charcoal surgical masks doesn't reduce the risk to zero. If it did, together with the wearing of a face shield, full PPE, gowns and gloves, then some of the hospital-based infections that we've seen wouldn't have happened. So nothing will ever be zero risk, but a scarf, a homemade mask, a bandana, or a medical grade mask, all of that is better than no mask or face covering at all. So that's the common sense element to this. As soon as we've got those really large stocks of reusables, we'll have some more to say in the next couple of days about how we're going to get those out to people, particularly to, I think, probably to more vulnerable groups. And the GP surgery example that I used is just one. We'll have a whole range of other points where people will be able to access one of those masks.
Second way is disproportionately affected vulnerable groups, high-risk groups. Given the outbreaks at towers and networks, distribution centres, very low-paid workers, will
Yes.
you be actively targeting vulnerable
Yes, May. So this is not so much people returning from a ski trip in Aspen. This is a very different wave, and we have a number of communities that are vulnerable. We have, I think, there's a much greater diversity to this second wave than there was previously, and that does present some challenges in terms of being able to making sure that we communicate the messages, that we're engaged with communities, that we're doing everything we can to make sure that people know and understand the part that they have to play. I think by and large, the message is getting through, and I'm deeply grateful to the vast majority of Victorians who are changing the way they live their lives, making those sacrifices in order to deliver a much better public health outcome. In terms of engaging with vulnerable communities, there is a power of work going on, whether it be in public housing, in lower income community groups, the list goes on and on. We're doing everything we can to engage culturally appropriate, language appropriate, trying to make sure that we're getting into all of those hotspot postcodes, as well as doing messaging and targeted work that applies to everybody. It's very challenging work, but I'm very grateful to people like Basher Hooley, for instance, who, as a fantastic Victorian, a great Victorian, and a real leader in his local community, he's been in his faith community. He's been able to get that message out. He's one among many people who are really stepping up and making that powerful point that this doesn't discriminate based on your postcode. It doesn't discriminate based on your bank balance. It doesn't discriminate on who you pray to or whether you pray at all. We're all in this together, and unless we all work together and moderate our individual behaviour, we will not get the collective benefit that we are all after, and that is this second wave ends as soon as it can, and we can then begin reopening up.
And have you been able to analyse the data on what percentage of what rate of these vulnerable groups you've been able to engage with?
I think we're...
That they've understood the message?
Well, that's obviously a reasonably qualitative issue. It's tough to get a real sense of exactly how much people understand and exactly how much people embrace the rules, and often people can be aware of rules but then make decisions to break them anyway. I think one of the worst excuses anyone could offer at the moment is, oh, I didn't know that was a rule. I think people do have a very high degree of awareness and understanding of those 4 reasons of what a stay-at-home order looks like. We are constantly engaging with different community leaders, as well as directly with different community members, to make sure that they're doing everything they can to get the message out, to see as much, not just awareness, but compliance with the rules.
Premier, just on hotel quarantine,
Sure.
what is the role that police are now playing in PSOs in hotel quarantine, and why the change?
Well, Corrections Victoria, this program has been reset. That's possible because we haven't had flights coming. There are ongoing arrangements. For instance, I can come back to you with a number of exactly how many people are in hotel quarantine. It'll be far less return travellers and potentially some more people that are in out of the towers, for instance, so people who have been unwell, who have got the virus, and close contacts who we've invited to move out of that high-rise tower and to go and stay at a hotel for the period of their 14 days. Corrections Victoria have the lead on this, but in relation to I think 1 or possibly 2 of those hotels where we try and cohort all the positive cases, Victoria Police are assisting us in that work also. So it's Corrections Victoria, Alfred Health, for instance, and they use their staff, the same staff that look after the Alfred Hospital, which I don't think anyone's got any problems with the Alfred. It is a fantastic hospital and one of our most acute hospitals as a trauma centre. But just to take that extra step, there's not only Corrections Victoria, but there is some Victoria Police support there also.
Why is that? Is that there aren't enough staff in Corrections Victoria? I do understand there was also some concern about regional areas of hotspots.
No, I don't think so. I think that there are adequate staff, off-roster staff from Corrections Victoria that have now joined the Department of Justice and are now employed and are directly accountable through that team that's been set up. I'm not aware of any issues like that. I think ultimately, particularly where you've got a setting where everybody in the hotel has got the COVID virus, then it just makes sense, as we always have, to take those extra steps, if you like, to try and make sure that you protect what is a particularly volatile environment. From a virus point of view, I mean.
Sorry, so police are being brought in, as well as corrections officers, in those hotels where everybody there has the virus,
That is my latest briefing. Yes.
As a measure of extra security?
I think so. Yeah, that'd be the best way to look at it. It's the best team to look after what is a very challenging environment.
Is this the original hotels that had, like, sorry, so you have a hotel where you're actually moving people that have the virus, or is it?
We've had that for a long time. We've had that for a long time, and again, I'm not wanting to cut across the work that begins tomorrow, but that's not where some of our significant problems have been. But this is just about bolstering that one step further, and I'm very grateful for it. It'll be a relatively small number of Victoria Police members, but they'll be, as they have done across the board, they're doing a very, very important job, and they're doing it well.
And my understanding is that there's some concern, particularly in the union, that they received not much notice about this, that they're not that jazzed about being exposed, and they're worried about the PPE and the training.
Well, I think that they're there in a, if you like, a leadership role, if you like. I don't think there'll be too much interaction between those police and, well, some will be patients in effect. They are in the care of Alfred Health. I'm confident that the arrangements there are above and beyond what's been there in the past, but the notion of grouping together those, whether they be return travellers or people who we've offered hotel accommodation for because their principal place of residence is not suitable for someone who is positive or a close contact, what's sometimes been referred to as a hot hotel, that those arrangements are not new. They've been there for quite some time, and that's not been where some of the challenges we've had have been. This is just about going that extra step. I think it's the right thing to do. I would just say on the issue of the union and others, police are deployed in a dynamic way, and they are deployed not by me but by police, senior Victoria Police. That's the nature of their work, and we're deeply grateful for them in so many different ways. This is a very dynamic situation, and they are deployed all over the state to do many things that I'm sure many of them didn't think they'd be doing when 2020 started. Yes.
Will it return?
I think Alex asked me this the other day. I'm planning to return. That's principally a matter for the Speaker and the President, and the only reason that it wouldn't happen is if the Chief Health Officer had different advice. That advice hasn't changed to this point, but again, back to the point I just made about things changing rapidly, we would have to see. But I'm planning to be back there as scheduled. That is ultimately, though, a matter for the Speaker and the President. So you want to? Sorry.
Are you attending with a face mask?
Well, I walked in here with a face mask, and I'll be walking out with one as well after I've washed my hands, though, because that's an important part of the rule. And there is a alcohol station, a hand wash station just at the door.
No,
At Parliament.
Face masks being mandatory in Parliament.
Well, I think if you weren't speaking, look, we'd have to get some advice in terms of the actual chamber. A bit like a call centre, for instance, might be very difficult to have that usual cut and thrust of the chamber if everyone had a mask on. But we might get some specific advice from the Chief Health Officer on that.
Can I just ask the Health Minister? Oh, sorry.
So just
Sure.
the federal government's due to announce the hotels are open this week.
They are.
And you want to just camp around what you feel, particularly here in Victoria.
I've made the point consistently with the Prime Minister, and I'm very grateful for the many different discussions we've had, as well as I've taken the opportunity, particularly given that the Federal Treasurer is from Victoria, to speak with him myself. Tim Pallas speaks with him much more regularly. I'm reassured that the measures that will be announced on the 23rd, hardship will continue to be the driving focus of those, and where there is greater hardship, then there'll be more utility for the federal government's package, whether it be JobKeeper, JobSeeker, or a brand new program that may have a different name. That's entirely a matter for them. But the good thing is, though, hardship is going to continue to drive their policy response and the practical assistance that they provide, and where there is greater hardship, there will be greater benefit.
Can I just ask the Health
Jenny?
Minister a quick question?
Sure.
Just with regards, you were talking about hospitals not taking an ad hoc approach when it comes to visitation. We've seen at the Mercy that they have stepped up their restriction a bit further, where new parents, so partners and fathers, closed first and aren't allowed back in. It's causing a lot of concern in the postnatal wards, hearing that some are discharging themselves after only a few hours. Mental health being significantly affected. Are you going to be talking to them about whether that is
Yeah, we know it's really challenging when you have your loved one in a hospital or in a nursing home, and to have restrictions around visitation, and the legal directions that have been in place already for some time and have been done on a national basis have been driven by limiting and wanting to limit the spread of the virus into those facilities to keep both our dedicated healthcare workers and patients safe. I know in light of additional cases of infections amongst healthcare workers that some hospitals have stepped up, I guess, and put their own policies in place in probably the last week or so. So we'll be making some changes in keeping with their wishes to take additional precautions. It obviously needs to be done in a very sensitive manner. There will be continued exclusions, enabling a principal carer to continue to have access to a patient in palliative care situations, of course, enabling parents to visit children who are in hospital. So we'll have more to say about the details of that in coming days, but there will be some additional limits placed on visitation, and I ask for understanding amongst Victorians at this challenging time. We know it's really, really hard if you have your loved one in hospital and you cannot spend as much time with them as you would like, but this is being done with a view to protecting patients, and so there will be some further restrictions that will be limiting visits largely to a carer having access for 1 hour per day.
So when it comes to new parents, are you saying that other hospitals will be stepping up to what the Mercy is doing now, or you'll be asking them to change how they're approaching it?
Yeah, so there have been hospitals who have put their own policies in place above and beyond what's in the legal directions. That has caused some concerns just because there isn't consistency across hospitals in terms of how they've approached these issues. So we'll be wanting to give some additional guidance to health services around these issues. Of course, they will still have the ability in their unique circumstances, if they so wish, to go above and beyond that, but we hope that this will minimise the circumstances in which that will occur. In terms of women going into labour, what has happened to date is that their partner, if they have one, has been able to be with them during labour and have had access for visitation afterwards. We know that these types of visits are really important in terms of, I guess, parental bonding with a newborn, and so we'll have to have some discussions with health services about how we can have some flexibility in the policy, but really being guided by putting the safety of both patients and healthcare workers first.
Will it become more normal for women to go home sooner on a daily basis?
We have had, during the whole course of this year, significant shifts in how our health services provide support to patients in their home. So our Hospital in the Home program has been around for a number of years, but that has been expanded this year so that more services are being offered in the home, and that includes women going home after the birth of a child. I know our Women's Hospital and other health services are providing that additional support to women, and they continue to get support in the home as is appropriate in those circumstances. Of course, elderly patients as well have access to further support. So rather than perhaps going into an elderly person going into a rehab bed, a subacute bed, they might be able to transfer post-surgery back home more quickly, get that support at home, keep them safe and keep healthcare workers safe as well.
Will police and PSOs be policing this on public transport as well?
In relation to masks. So there will be enforcement of masks, and as we've explained, there's a $200 fine. We'll be doing a lot of communication in coming days around mask usage. As the Premier explained, we'll particularly be providing support to vulnerable people in our community. At the present time, we have been doing an extensive testing program in our public housing estates, and as part of that testing program, we're also distributing disposable masks to those public housing residents. Once the Victorian Government does receive our reusable masks, we're then going to work through with community health centres and others distribution of those masks to public housing residents and other vulnerable people in our community, including people with chronic health conditions.
And just before you said that movement between aged care facilities will be minimised, does that mean there will be some movement between facilities, or is it
I should acknowledge the efforts of the aged care sector at this really challenging time. Aged care providers in Victoria, together with health sector unions, the Commonwealth and Victorian governments have been working very closely to try and minimise that movement. We know it does present a risk. It's really challenging for casual employees who rely on picking up shifts across different locations, but the package that's been announced today is really designed to minimise that. And the larger providers in particular are providing some ongoing support to smaller aged care providers in Victoria, particularly around infection control advice and advice about how we can minimise these types of arrangements going forward. The funding from the Commonwealth is designed to ensure that aged care workers are not worse off or not being disadvantaged through these changes. Is there anything further? Thank you.